This is a video for expecting parents who may be interested in consenting to their baby being part of the POLAR research trial. The POLAR trial aims to improve how we support breathing at birth for very premature babies born before 29 weeks of pregnancy. This study is a comparison of two techniques used to help support and inflate a preterm baby's lungs at birth. Unlike term-born babies, premature babies' lungs are underdeveloped, fragile, and prone to deflating too much between breaths. In particular, very preterm babies nearly always need help to support breathing at birth. To help get breathing started, doctors place a soft mask onto the baby's face. The mask is connected to a device that continuously delivers oxygen and gentle pressure to the lungs to keep them from deflating too much between breaths. This pressure support is called PEEP. This stands for Positive End Expiratory Pressure. Whilst we know that almost all very preterm babies need PEEP at birth, we don't yet know the best level of PEEP to use. Currently, clinicians use a range of different PEEP levels without good evidence to guide their choices. This study compares two different PEEP approaches in the first 20 minutes after birth to help support a baby's lungs. One approach is to use a constant, unchanging or static level of PEEP. This practice is commonly used in hospitals today. Babies in this group have their PEEP level kept constant at the lower end of PEEP levels typically used around the world. In the second approach, PEEP is started at the higher end of PEEP levels used around the world. Then, the PEEP level is adjusted or individualised based on how the baby's lungs respond to treatment. If a baby is not responding, their PEEP can be adjusted up and then back down in small steps as their condition changes. This changing level is called dynamic PEEP. We believe that this responsive and briefly higher PEEP may be the best way to help a preterm baby's lungs inflate at birth. All other aspects of newborn care for babies in the POLAR trial are identical between the two groups of babies and follow standard practices for your hospital. What are the benefits of PEEP? Almost all very preterm babies are treated with PEEP. We know that PEEP helps babies breathe, spend less time on breathing machines, and reduces their risk of lung damage. Both of our PEEP approaches have been used to help very premature babies, but they have not been compared with each other in a large trial. This study is looking to see whether one PEEP treatment is preferable to the other in supporting preterm babies' lungs after birth. For babies who join the study, we collect data on their progress, paying special attention to how much breathing support they need throughout their time in hospital. We also collect information about their development and general health that are part of the recommended routine follow-up at 2 years of age for all very premature babies. What are the risks? We know that very premature babies are at risk of complications, especially lung complications. So we are monitoring all babies in the POLAR trial very closely. Doctors have been using PEEP to help preterm babies for many years, and we don't have any reason to think that babies in this study are at any more risk of complications than babies born preterm who are not in the study. What happens if you choose to participate in this study? We will ask you to sign a consent form allowing the research team to collect medical information about your pregnancy and about your baby's course after birth. In the delivery room, your baby will be randomly assigned, like flipping a coin, to one of the two PEEP approaches, which will then be the approach used by the specialist doctor caring for your baby. If you choose not to participate, your specialist will choose what PEEP level to use at birth, according to your hospital's practice, and your baby will not be randomly assigned to one of the approaches. If for any reason you join the study but then no longer want to participate, simply ask your nurse or doctor to notify the research team and your baby will be removed from the study. If you have any additional questions, please let your nurse or doctor know so that we can speak with you. It is okay to choose not to participate in the Polar trial. Your decision will not alter how the nurses and doctors care for your baby. The Polar trial is a multi-centre study that will include more than 900 very premature babies from around the world. Why participate in the Polar trial? As doctors, we need to base our actions on good quality evidence. Clinical studies like the Polar trial help us to make the best decisions for all newborn babies, many of whom will be similar to your baby. By joining a study like Polar, you are helping doctors worldwide to make better decisions for generations of babies to come. Even if the treatment given to your baby may not directly benefit them because we don't yet know whether one PEEP approach is preferable to the other. By determining the best PEEP approach at birth, we hope to give future preterm babies the best start to life. For more information on the Polar trial, please visit the website polartrial.org.au. Thank you.